Kaieteur Radio.
Covering Guyana from coast to coast.
Demerara and Essequibo 99.1 FM.
Berbice 99.5 FM. Kaieteur Radio.
Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning into Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
Good afternoon, everyone, and welcome to another edition of Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and I have with me today, she's joining us via Zoom, Miss Candace C. Lam. She is a pharmacist attached to this Cinco Trading Limited, and we're really talking about the dangers of over-the-counter drugs and prescription medication. And Ms. Lam?
Hi, good afternoon, Rihanna. Can you hear me? Hello?
Good afternoon.
Hello? Hi, good afternoon. Can you hear me clearly?
Okay, we're hearing you a bit. Okay. The sound is now coming in. I hope the listeners and viewers are getting a better feedback than I am.
Okay,
so we're talking about the dangers of prescription medication as well as over-the-counter drugs. And towards the end of the program, you'll give our viewers and listeners some health tips on how to stay safe during this rainy season, how to keep their immune system boosted so that they won't get the flu or cold, the virus or anything like that. We were supposed to have, Dr. Samlal on today, and she was supposed to be here to talk about the new coronavirus variant, but she had to, some other engagements, duty calls, and we can't be, you know how doctors are. They're always on call, so we had to have you fill in, and we're glad that you can do that on such short notice. So for those who were expecting Dr. Samlal, she had an engagement that she couldn't get out of. So let's go into our topic. So we're talking about over-the-counter medicines. Those are very dangerous, and they can severely affect your health, and people don't realize it. So I'll have Candace touch on some of the medication that are commonly misused, over-the-counter drugs, that is OCT, that are commonly purchased and misused in Guyana. Candace?
Hi. Okay, great, Rihanna. So let me start by saying OTC drugs are medications that are safe and effective used by the general public without seeking treatment by a health professional. So some common examples of OTC drugs would be your pain relievers. You have Tylenol, Advil, Motrin, Excedrin. Another example would be cough suppressants. So there is dextromethorphan, which is the active ingredient in Robitussin. There is codeine, which you can find in codeine linctus and some versions of dry cough syrups available for over-the-counter use. And another category where you can get over-the-counter drugs are antihistamines. So an example would be your loratadine, which goes by the name Claritin. It's another Bayer product. We also have Puritan too, that's over-the-counter.
What about the aspirins and hyperpropane? Are those commonly misused drugs here in Guyana?
I believe is commonly misused too. Aspirin, not so much, but ibuprofen, yes. Ibuprofen would be your Advil. And we also have Aleve, that's another common OTC pain reliever as well.
And if you were to give like a top three of what are some of those that people regularly buy and just use at, whim, could you say, like, give the top three?
Yes, definitely pain relievers, any of those that I mentioned, and cough suppressants. Those are the two main common ones that are mostly misused.
And how does this happen? How do you end up misusing? When you say misuse, how does a person end up doing that?
It can be anything in moderate amount is good. We all know that if you overuse or misuse it, it can cause a lot of side effects or damages to your health. So a few of the common dangers of OTC, you can get memory loss from it. There can be gastrointestinal issues like GI distress. You can damage your liver and kidney. It can lead to depression and anxiety, and in some severe cases, hallucinations, delusions, even stroke or heart conditions. It all depends on the level of misuse that a person would go about using a drug.
And in terms of when you talk about misuse and so on, there are symptoms before you get to that stage of getting a heart attack or stroke. So what are some of those symptoms you have to look for?
You would find teens and some young adults are common persons that would abuse OTC drugs. So for teens, they like to go towards the cough medicines. So for example, the Robitussin, like I mentioned, with the dextromethorphan, or the codeine linctus, they come for those. You can also get them misusing any drug with pseudoephedrine, which you would find, for example, in your Advil and sinus. And these tend to lead to a sense of stimulation and euphoria for them. So it gives them this out-of-body sensation when they go way beyond the general recommended dosage. So a good thing to mention, parents can look out for certain symptoms or side effects if they suspect that their teens are using or misusing OTC. So some common symptoms and signs to look for would be breathing problems. They can be extreme drowsiness, vomiting, blurred vision, and they can complain of rapid heart rate.
In terms of, I understand that because we had a pharmacist on the show before and she touched on how teens use these over-the-counter drugs or drugs that they can get their hands easily on, and they mix it with alcohol and, for this high. How common, I don't know how common it is if from your perspective, and could you say how dangerous, how much damage it could do to their health?
Well, it can be mild to moderate damage depending again on the misuse, or it can even lead to, as I mentioned earlier, they can be heart conditions, there can be liver dysfunction, there can be kidney damage, and it can even lead to death in possible cases. Because aside from being addicted to it, where you get hooked on it, it can also lead to death, and it can damage major organs in the body.
All right, we'll just take a short break, and when we come back, I understand you have something for our viewers, those who join us here regularly on Your Health Matters. She has I
have a giveaway, yes.
Yeah,
a nice little bag of goodies to give away.
Okay, so if you're listening, you can call in just towards in the next 15 or 10 minutes because we don't have a lot of time. So we're wrapping up quite shortly today because Miss Lam is on the road and there's so much to do, so we're just going to have a short program today. So let's go to the break, and when we come back we'll have you touch on prescription drugs, and then we'll have the call-in.
Okay, great.
Bye-bye.
Win big this Christmas with a digital
Good afternoon and welcome back to Your Health Matters here on Kaieteur Radio. We are discussing the dangers of over-the-counter drugs and medication as well as prescription drugs. And with us we have Ms. Candice Lamb. She is a pharmacist attached to the DeCinco Trading Limited pharmacy branch. And she's talking to us about, she's helping us to understand some of the intricacies and the dangers that is related to that use or misuse of medication. Ms. Lam is joining us virtually, and she is... Ms. Lam, are you there?
Yes, I'm here, Rihanna.
Okay, and she was talking to us earlier about over-the-counter drugs or OTC, and now she will touch on prescription medication because we'll have a little bit of call in later on, and we'll have give our viewers and listeners a chance to win a bag of goodies, compliments of DeCinco. So, Ms. Lam, as we go along, we were talking about over-the-counter. Now we're talking about prescription, and that's not something that people realize they can misuse a lot of times. They think that, okay, once we're using it how we think we're supposed to use it, it's and we don't see any symptoms, it's a good thing. But you can touch on that and tell us some of the dangers of that.
Yeah, so to note, Rihanna, prescription drugs are only safe for people that have prescriptions for them. This is because a doctor has to examine that person and they prescribe the right dose of medicine for that person's medical condition. So if you think you have a condition, so most cases we would find a lot of patients or people would go into the pharmacy and say, okay, I have a cold, I need some antibiotics for this cold. Antibiotics don't work like that. Prescription medications don't work like that. And you would find cases whereby they would raid their family's medicine cabinet and take some leftover pills and try to use it. So for some condition they might think it would work for. So all of that falls on the misuse of prescription drugs.
And what about,
like I mentioned, some common ones that persons tend to misuse are not just antibiotics, but antibiotics are the main one. And you can also get them misusing sleeping pills and anxiety pills.
And these are addictive pills, right?
Yeah, so for the sleeping pills that are prescription only and are given for short durations due to a possible addiction would be Valium. A lot of them know it as the little blue pill. Another one would be anxiety pills, for example, the Xanax. And antibiotics fall under so many different ranges and classes, but the most common ones Guyanese like to misuse is the black and red and the orange and red. Everybody has heard of the black and red antibiotic.
That's our favorite. But in terms of that black and red specifically, tell us about some of the problems, the health complications we can develop as a result of using that over a course of time too much, misuse or overdose or whatever you want to call it. What are some of the complications of using that particular drug?
Well, what happens in terms of antibiotics? So the red and black is known as ampicillin. Misuse of ampicillin can cause your body to develop a resistance. So developing a drug resistance is very dangerous because what happens if you use the wrong antibiotic for the wrong condition? For example, let me reference persons asking for it or using it for a cold, right? Now, cold and flu is viral. Antibiotics treat bacterial infections. So when you use that black and red to treat a cold, all you're doing is developing a resistance to the drug. And it turns that cold or flu into a superbug now. So when you share it with another person, it's not just that strain of flu, you're sharing a superbug strain of flu. So that's why you would find some patients, it's harder to get rid of certain cold and flu symptoms or to get rid of the cold and flu in general because it's constantly mutating. And in cases like that, what happens to that particular person is that, let's say they need antibiotics to treat a different condition in the future. You would find most classes of antibiotics will no longer work for them because their body has become resistant to antibiotics or drugs in general.
Right. And you're talking about the antibiotic, can you say what other type of drug specifically, and could you touch on the complications of that, like commonly used in Guyana, like say Hyperpropane? what are some of the complications of hyperpropane?
Well, ibuprofen, common complications you can get from misuse would be GI distress or gastrointestinal distress. They can cause stomach ulcers as well. Overuse and misuse of painkillers can lead to stomach ulcers.
And in terms of, let's say, aspirin, is that something that we should look at in terms of that using aspirin? Are there...
Well, aspirin should only be as prescribed by a doctor. In most cases, you would find older people would use aspirin, and that's by prescription, whereby a doctor would give it for them to use in their drug regimen to help prevent heart conditions, and it helps to thin in the blood and so on. But it's not supposed to be used by younger adults or just any and everyone. Thinning of blood can cause a lot of side effects if misused as well.
And
so for
when
example, if that person gets a cut now, you would find their blood is not clotting. The clotting factor would be very depleted in that person.
Wow.
Because of the use or misuse of aspirin.
And when somebody, let's say in a scenario where I have high blood pressure or I suffer with a certain type of illness, and my neighbor has a similar, or he has the same thing, or she, can misuse fall under me borrowing or
because if
collecting
you, for example,
something?
go and ask your neighbor for one of the pills that they're using, you have to remember that each drug is prescribed or given to a patient depending on that patient's history, their family history, the conditions, what they may have used in the past to control their blood pressure. There's a lot of different factors doctors consider before just giving a patient medication. So it's not just like any type of, let's say, hypertension drug that they just give you. It all depends on the person itself and that specific person. So the drug is tailored for that person. So for example, what might work for them might not work for you. Or it might cause more side effects in you than with the person that's using it.
Wow. But I mean, based on our culture, we would find that people still do this from time to time. What
I'm hoping to is that persons realize that it's good to monitor your blood pressure. So, for example, at Disinco, we sell the Omron blood pressure monitor. It's one of the most accurate ones, and it's so simple to use. If you think your pressure is high, I would advise you to invest in an Omron blood pressure monitor and regularly check it. Sometimes you've had a stressful day today, your blood pressure could be elevated because of that, but it's not going to mean that it's going to be high tomorrow or next week or the next day. So good monitoring is really good in effective health care.
We went off topic a bit, but thank you so much for mentioning that, because it's all on the health. In terms of, we understand that Disinco is a distributor of the redoxon vitamin.
Redoxon vitamin C.
Redoxon.
So Redoxon is an orange flavored effervescent vitamin C tablet. It's from Bayer. We have two types, the plain Redoxon and the double action Redoxon. So the double action has zinc in it. Both of them contain 1,000 milligrams of vitamin C. And it helps to keep your immune system boosted. So in the time that we're living in and we're constantly at work and doing multiple things, it's always good to maintain a high immune system. Keeping that high immune system helps to fight off bacteria, illnesses, and even the common cold and flu that we're talking about as well.
Because I was going to ask you just now, is to touch on some of our the general health tips, given that we are dealing with a lot of rainfall and it's likely that flu, they will see an increase in flu cases or colds and so on. You touched on the use
definitely there already. The flu has been going around already. So boosting your immune system is very important, and that's where Redoxon come in hand. So a quick thing to point out, not a lot of people know this, is that you can get 10 oranges worth of vitamin C in one Redoxon pill.
Wow.
So you just drink one Redoxon a day, that's equivalent to 10 oranges. Your immune system is covered for the day.
That's great. All right, so let's go. We're going to open it. You have the questions, right? So we're going to...
So just before we go, let me mention Redoxon comes in boxes of 12s and 36. It's available at our Disinco branch, Cash and Carry on Sheriff Street. It's available at Massey pharmacies all across Guyana. You can get it at Medicine Chest Pharmacy, Medicare, Punai's, DSL, and Bounty as well.
All right. So we have Miss Lam, and she is a pharmacist, and she will be. We'll open the phone lines a bit so that somebody could win a prize, a bag of goodies, compliments of the Cinco. And Miss Lam, you have your question ready, or?
Yes, I have a question ready. So this is just simple.
Okay, just hold. Let's open the phone line.
What is Redoxon? And list one location you can purchase Redoxon at Ingayano. Just one location, and what is Redoxon?
Okay, let's open the phone line and see it. Anybody? Hold on. So the number is 226-7453, and you can call in to get a chance to win a bag of goodies, compliments of the Cinco. 226-7453. Okay. Good afternoon. Oh, we lost that caller. Good afternoon.
Good afternoon. Hello.
Hi, good afternoon.
Good afternoon, babe.
Hi.
I'd like to answer the question.
Yes, go ahead.
Sure.
Pharmacy.
Sorry, we didn't hear you clearly just now.
Punai's Pharmacy.
Mm-hmm.
Yes. And can you tell me what Redoxon is?
Redoxon is an immune booster. It's a vitamin immune booster.
Yes, correct. It's an effervescent immune boosting vitamin C.
Yeah.
Okay, great. Can you give me your name and a contact number, please?
My name is Kalawati, one name.
Okay,
And my contact
Kalawati.
number, yes.
Go
My
ahead.
contact number is 220 8483.
8483.
Where are you calling from, Kalawati?
Montrose.
Montrose, and you usually listen to the program?
Yes, I do.
Okay, thank you for listening, and thank you for calling.
I was a hospital staff formerly, so it's kind of interest to me.
Okay, that is so nice to know. All right.
Well, thank you for listening in and calling, and I will call you shortly after the program to tell you more about your prize.
Okay, babes. Thank you very much.
You're
Bye-bye.
very welcome.
Bye.
Okay. So we have today was a really, really short show. Thank you so much, Candace. Thank you, Kalawati, from Montrose.
Yes, Montrose. You're welcome, Rihanna.
So we have to go. We had a short program today. We have to go because we have some other engagement. Miss Lam has some other engagement. I think she's in the fields today. So we want to thank her for coming on so shortly to filling in for Dr. Samuel, and maybe on another program we'll have a more lengthy discussion with her. Thank you so much for joining us via Facebook or via radio. Thank you for listening, and be safe and be good to yourselves until next time.
No, thank you too. Bye.
Goodbye.